Let's talk about circumcision. So male circumcision is the surgical removal of the foreskin, and it can be done for a number of reasons. One of the most common is for religious reasons within some religious groups. It's important to note that that is not available on the NHS. There are several medical reasons for someone to need a circumcision, but they're not that common because there are lots of other treatments that we can do and try which can usually alleviate symptoms, and they're really good. So it's only when those things have failed that we start thinking about things like a circumcision. So these conditions can include things like phimosis, which is a tight foreskin, recurrent balanitis. So this is just where you have recurrent infections of the head of the penis and the foreskin. There's something called paraphimosis, which is where the foreskin retracts and it can't get pushed forward, and this can restrict blood flow to the head of the penis, and that can cause all sorts of nasty, horrible problems. So if that's happening, or if it's happening recurrently, then again we can carry out a circumcision. And then finally, there's another condition, I think it's called Balanitis, xerotica, obliterans, is an inflammatory condition where the foreskin becomes really tight, but also the head of the penis can become really scarred and inflamed. There are some risks associated with a male circumcision, but the risks are generally quite low, particularly when the procedure is carried out by a qualified medical professional. The main risk is bleeding, either during or after the operation. During the operation, your surgeon should be able to seal off any bleeding, but if the bleeding does continue after you return home, please do seek medical attention. Other possible complications are pain, infection, and scarring. Because we've been talking about circumcision so much, I think it's probably important to touch on how the foreskin actually develops, because one of the main indicators for a medical circumcision is phimosis, which is a tight foreskin. Now, it's really important to be aware that as a male baby grows up, for the first few years of the life, the foreskin is actually attached to the head of the penis, so you can't retract it. After the age of about 3, it starts to separate and you might be able to retract it a little bit, but it can actually remain slightly attached for several years after that. Most boys' foreskins don't pull back before the age of 5, but in some, it can extend up to the age of 10. As the foreskin starts to separate from the head of the penis, you can actually start seeing a ballooning of the penis, or ballooning of the foreskin, whenever the boy starts passing urine. That's nothing to worry about, but what it can do is it can increase the risk of having infections, so an infection called Balanitis. And if that happens again, just visit a doctor. Very, very easy to treat, usually with just with a cream that you apply to the head of the penis or and to the foreskin. But what's really important is don't try and forcibly retract the foreskin, because it can cause a lot of damage and it'd be very painful for the child or for you. Anyway, hope you found that helpful. Like, follow, share, subscribe. You know the drill.